channel. It's Angel, the Psych MP. So, look at my reindeer sweater. It's Christmas Day. And I was off today. The testing site was closed. For those of who don't know, I work at a testing site. I was closed Christmas Eve and Christmas Day, but both days I really didn't do much of anything because I have been working 7 days a week, except for Thanksgiving Day we were closed. I believe we were closed on 4th of July, and every other day we've been just open 7 days a week. So when I kind of get these days off, I just like to relax and just kind of read up on what's happening with the virus and everything like that. I like to stay in the know of what's going on because I'm not physically working in the hospital right now. So, but I do have a lot of eyes and ears in the hospital. A lot of my friends are out between Texas and California working in the hospital in the trenches, and some of them are there today. I wanted to kind of jump on here tonight and kind of just talk about the mood of, some of my friends in the hospital right now. A lot of them are feeling like very sad. They're away from their family, they're away from home, but everybody kind of took on a mentality of, hey, like, we can't gather anyway. The reason, people in the nurses are taking it, who are out there working in the trenches, they really know what's going on. Like, the media is kind of giving like a watered down to some extent compared to what it was in March. The numbers are like way up. The hospitalizations are way up. The deaths are way up as well. And I just don't feel like the media presence of it all is the way it was in March. In March, you couldn't stroll social media without somebody on there live from the hospital showing you their breathing difficulties, or just something was there. We don't have that now. So I think the public don't really know how bad the virus is right now. But I have friends in the hospital, and let me tell you, they don't mind being at the hospital working right now because they don't want to be gathering. They're in there watching what's happening. A lot of things are happening in the hospital with people's lives because we just don't have enough staff anymore. They're increasing patient ratios. So in California, I've been a travel nurse in California for about 4 or 5 years, up until the beginning of this year when I came back to Miami. But California is very strict on their patient ratios. ICU 2 patients, med surg 5 patients, tele 4 patients. In Florida, you can have 7, 8 patients. On the East Coast period, you can have 7, 8 patients, med surg, tele, whatever. But California, because we're so short of nurses, that they're trying to increase the patient ratios. There was an article that I read that I'm going to post an article that said that in California, they have patients in parking lots right now, within beds in parking lots, because they have nowhere to put them in the hospital. So they have ICU patients this is not just California, this is different places. They have patients in the ICU they have patients on med surg tele floors because they have no more beds in the ICU. So for those of you who don't know, ICU is equipped for the sickest patients. Their monitors are equipped to go along with, being able to record vital signs and do different things. And you can do a lot more with their monitors because they're equipped for the sickest patients. On the med surg tele floors, depending on what hospital you're in, they're not equipped that way. If you probably in one of the more top of the line hospitals or one of the higher ranked hospitals based on care, whatever it may be, you may have those same monitors throughout the hospital, but for the most part, a lot of hospitals aren't like that. So you have nurses that are med-surg tele nurses trying to take care of ICU patients. So because of that lack of training, you're going to have some people that, for lack of a better word, fall through the cracks, in the cracks with their lives, because we just don't have enough resources to help people. People are still gathering. I'm looking on my social media, people are still gathering, people are still just out without masks on. And I think the media needs to kind of put that fear back out there like it was in the beginning. There was a lot of fear when this thing first came around. Now it's almost like people treating it like a flu. But about 2,900 people died yesterday on Christmas Eve. About 2,900 people died. I was going to wait to see what the numbers were for Christmas Day, but the numbers have been consistent between 2,500 and 3,000 people dying per day. And this is across the United States from this virus. In one area, a friend of mine told me that they don't even do CPR on patients right now. And I can understand that because because it's such a deadly virus, if you're doing CPR on a patient, and I've done CPR on a patient before, you're pressing down on their, on their chest, and their breath, because they're in an unconscious state, it's like they're breathing up, and that air is just being exposed to you. So I can understand that, because you have to understand, we have to protect ourselves first as well. And I know somebody may say, oh, you got your N95 and you have your, your face shield on or something, but you just don't know. You just don't know. In the middle of a cold, when you're doing that, sometimes your mask can shift or whatever. A lot of moving parts are happening in the cold, a lot of people in the room, and you just don't want to take that risk. So in one hospital, I heard that they are, once you're maxed out on your vent settings, it's almost like once you start going down, there's nowhere else to go from there, because they're not going to do CPR on you. Another hospital, I was told that they are doing CPR, but there's a CPR team that has to come around. So if you all don't know, because you're not in the medical field, or for those of you that do know that are in the medical field, waiting on a CPR, that's the whole reason of it being called a cold blue, is for some people to get in the room and immediately start CPR and start administering life support, to bring you back, or try or make an attempt to bring you back, pushing emergency medications, what we need to do in the middle of a cold. If you have to wait on a team of people to get there to start CPR, because we're in the middle of this pandemic and there are colds happening all over the place, and they don't just want anybody going in there to start the cold, there's a good chance that you're not going to make it, because time is brain. Time is heart, time is circulation, all those things. Time is very important in a life or death situation. The more time away without having those life-saving efforts being applied to you, when you stop breathing or when your heart stops or whatever the case may be, the chances are very slim for you. So that's some of the things that we're facing in the hospital right now, is lack of resources to get there and administer CPR. Or some hospitals, like I said, aren't doing it at all. It's so many things. So what I wanted to talk about too as well is how that is affecting nurses, or respiratory therapists, or environmental services, or whomever in the hospital that are witnessing these type of things happen. It post-traumatic stress disorder is what is going to be happening. Depression is what is going to be happening. Anxiety is what is going to be happening. It's not going to be good. I talk to one of my friends all the time. When she come home, she's so exhausted. They're working 6 and 7 days a week. When she goes back to her hotel, we kind of chat about it. I chat with a lot of my friends. The thing about me is that I've always been somebody that you can come to and talk to about anything, even before me being the mental health nurse practitioner. Like, that is my calling. All my friends know that they could come to me about anything. And even if you're not my friends, I've met people that people always say, people just come up to you and then they meet you and they start telling you their whole life. I've always been that person. But my friends who out there in the trenches, I'm constantly checking up on them. Hey, how you doing? Like, how you feeling? What's going on? Let me know. What can I do? Do I need to send you anything? Because I know that this situation that they're in and they're facing is not good. The reason why I kind of just chilled today because I know what my friends going through out there. I didn't want to be on social media posting, all my gifts like I'm just having this wonderful time, because I really wasn't. And I'm worried. I'm not worried, but I feel for them about what they're going through. I'm not worried because I know that they're being safe as they can. And I know that this is what we as nurses are called to do. So it's kind of like being in the military. And when you're called to duty, you have to go. When you get your orders, you have to go. And it's kind of like nurses are on orders right now. This is what we're called to do. This is what this is what we do. No, we didn't know we would have a pandemic in our lifetimes, but it's part of the game. It comes with the game. So I tell some of my friends, like, when you come in from that hotel, zone out from social media, because you're away from your family. And this last week, all you see on social media is people posting their family pictures and stuff. And that's great, because even the people who are in the community, like, they're dealing with just the aloneness of the holidays, or not being able to do things like they used to do. Like, 2020 has been a lot on everybody. So I commend the people that are, doing their family pictures and stuff like that, because that means that they're still pushing through everything that's going on. But for my friends that's like out there working in the trenches, I was like, you may not want to see that right now, because it may start triggering you to think about, oh, I'm away from my family. I'm here. People are dying all around me. One of my coworkers told me she was out in New York and Texas and Arizona. And she told me she can tag toes, like she have dreams and nightmares of her tagging toes in her sleep. That's an indication of how many people that's been dying, not necessarily her patients, but just on a unit in a hospital, of going to help out with people who died, because they're getting these bodies out of there so they can get another one in there. In a hospital, when someone dies, on my trauma unit, we usually give the family like 4 hours to come. Like, this is after we clean them and everything like that. 4 hours to come, see them and all that before we take the body to the morgue. But right now, they don't have that time. It's like, oh, they died. Okay, call environmental service. Let's get, and I don't mean to sound insensitive, but this is just a reality of what's happening in the hospitals right now, because we need to get the next person in that room hooked up to the monitors to try to save that person's life. It's like really wartime out there, like a war zone. I know we all seen some war movies where everybody getting shot up and all that, and then your partner or your come and grab you out, and then they get you safe, and then they got to go back out there, and it's just like, that's how it is. It's like a wartime. Like, everything is happening so fast, everything is on to the next. You have no time to even like grieve or process what's happening when one of your patients die. There's a policy at one of the hospitals I worked at, one of my favorite hospitals I worked at, that said no one dies alone. And what that was that there were people who were retired people. They were volunteers for the hospital. And when we couldn't find any family members for a patient, or if the family member lived like on the East Coast or somewhere where they just couldn't get there, they would come and they would sit in the room with the patient until they expire. They would take turns or whatever it may be. I don't know the logistics behind it, but there was always someone there so that no one dies alone. Now people are dying alone because they're not letting patients their family members in the room and stuff like that. So it's like the nurse is like the last person that is in the room with these people. If you were there from a time when the patient was, let's say, came in and said, oh, I had shortness of breath, and they started deteriorating, and you keep telling them, oh, it's going to be okay. Let's do this. Let's try to get you on this oxygen. Let's try this. Let's try this. Let's try this. But everything you're trying, the patient is steady deteriorating. emotionally, and as a nurse, you're going to start feeling some type of way because we gain connections with patients when we taking care of them. If you taking care of the same patient, that usually how it goes for you. Don't people who are not in the medical field, you go home and they try to give you your same patients back. If you come back, 3, 4, 5 days in a row, they try to give you your same patients back. So you end up building rapport with these people. And if you had some young guy who came in the hospital with COVID that was once talking to you but having some shortness of breath, and then you started, they started talking about your family because they have nobody else there. So they're talking to you while you taking care of them about their family, their kids, and you start to know things. And then they start telling you about their story, their life. Then you start deteriorating. And then it goes from not being able to talk to just being able to hold their hands. And then to them not being conscious anymore that you're even holding their hands. And it's just, on the nurse, it's a lot. It was a lot even before COVID. And I can't even imagine now because I'm not right there working in the hospital. But like I said, my friends are telling me it is a lot. You do not want to have to go in that hospital for COVID because sometimes it's not even the virus. It's just a lack of resources that we can't get to you. And when you need us, and you're going to be deteriorating. There's not enough staff. In the Spanish flu, I read an article that said that in the Spanish flu, the second wave of the Spanish flu, I think there was some type of parade that they still had that they weren't supposed to have. I think it was in Washington or something like that. It set the second wave forth. What the equivalent to that parade for us right now is the holidays. We had Thanksgiving. What we're seeing in the hospital right now is the wave from Thanksgiving gatherings. We're not done because people are gathering today for Christmas. And guess what? We won't be done because the New Year's Eve parties will start. And so on. So those 3 holidays, which usually, go together, the wave of those holidays, we probably won't finish those waves until like February because people are still gathering. Okay, if you're going to gather, wear your mask, because the truth is that if you catch COVID and you go into that hospital, you may not necessarily pass away from the virus being so bad. You may just pass away because we don't have the resources. This is exhausting on the medical field. This is exhausting on the staff. And they're having to pull people out of school and stuff that aren't fully trained and ready for this. Is that the person that you want to have to take care of you if you're in the hospital? I don't think so. You want somebody trained, and everybody in there not trained right now. We're utilizing the resources that we have. So take that in consideration, guys, when you're out there partying and everything like that. If you don't even believe in COVID, if you're one of those people, if you get some random virus, since you don't believe in COVID, and you go into that hospital, just know that the care you get may not be the level of care that you would normally have because there are no resources right now. Some of those high-paying contracts that y'all seeing on the news and social media, what they paying nurses, a lot of those contracts are because hospitals don't have staff. And they need nurses. They need people to come in and take care of these people that won't do right, that won't, wear masks, or that they're still gathering. So to my nurse co-workers, my respiratory therapists, my environmental services, everybody in the hospital that has some type of contact with these patients or not, if you're in the hospital in that environment, something I want to recommend to you: when you come home, tune out from social media. Take some time to do something that will give you peace. Social media, if there's some pages you follow that make you laugh, okay, fine. Go to those pages, get your laughs you need, but don't just be aimlessly strolling social media, because I just think that it could be toxic for you. If you're in the hospital dealing with so much death and you're exhausted and you're away from your family and you're seeing all these things, zone out from that stuff. Find you a good movie on TV to watch or something that will give you some type of relaxation. Take a bubble bath, light some candles, get you a bottle of wine, you know, something you need to do to zone out and just take care of you. You can order from Amazon, Target, or somewhere. They have all type of massagers. Give yourself a massage, like buy these massage things so that you can release some of the tension that you're carrying from just working and flipping patients, you know, to clean them and all the stuff that you do. You have to find ways to take care of you in a time like this. I don't know how many of you are, you know, Christians or read your Bible, but I don't know how you can be not even just during this pandemic, but moving through life without God in it. So you need to either find Jesus, or if you're already there, you have to get in that Bible and find you some peace that surpasses all understanding. Because I do know that, and I've had a conversation with one of my friends, when you're in that hospital and you're looking at this time right now, you're thinking, is this the end? Because there doesn't seem to be a finish line right now. So you need the peace that surpasses all understanding so that you can go to work day in and day out and have peace in knowing that you're doing the best you can, and that there has to be you know, a light at the end of the rainbow for you in this situation of dealing with, you know, these COVID patients, and, you know, the exhaustion that, you know, everybody is COVID fatigue right now. Not just the healthcare people, everybody has COVID fatigue. I equally think that's some of the reasons why people aren't wearing masks anymore. Everybody got COVID fatigue. Nobody wants to be wearing a mask anymore. You know, I seen a guy the other day in the grocery store. He forgot his mask in the car, and he had to go back to get it. But when he went back to get it, he just was upset because it's like, oh, why I gotta have this mask? Like, you know, I just wanted to get out of my car and go in the grocery store. But then I realized everybody else had on the masks and walking in there. He was frustrated with the fact that he had to go back to the car and get the mask. But he did. But I think that's what, you know, the term COVID fatigue is. People just tired. But we can't be too tired that our life doesn't matter, because the result of being tired and not wanting to wear the mask and doing what you want to do could be death. So I just wanted to hop on here. I know this is kind of like a video that you may not want to be watching on Christmas, but I wanted to get on here and say it because Christmas is very, very different this year. And I talked to a lot of my co-workers that are in the hospital working on Christmas. And like I said, working on a holiday is not abnormal for the healthcare field because the hospital is open 365. But working in a hospital on Christmas and all you hearing is cold blues all day because people are dying, and it's like really nothing you can do about it. It's different. It's different as well as because people who would normally be home with their family, nurses won't be all over the world, you know, or the United States trying to take care of COVID patients. They'll be home, you know, they'll be working at their hospital and they can go home at night to their family. This is different because they can't do that. They're going home to a hotel room that they've probably been staying in for months because they've been out there taking care of COVID patients. And somebody got to do it. Somebody got to do it. It's like taking one for the team. I'm not out there in the hospital right now, but I am at the COVID testing site, and we seen about we did a total of maybe 12, 13,000 tests. And I believe all those people were testing, you know, the site was so busy because people were getting ready to gather. They were getting ready to fly and go home. All things that we shouldn't be doing. But hey, if you're going to do it, then at least know your status and wear your mask. So we have not been defeated by this virus yet. Merry Christmas, happy holidays, be safe, try not to gather. It's bigger than you thinking about COVID. Just think about the healthcare field and the exhaustion and the overwhelmingness of the staff, and you just don't want to be in that predicament where you have to go in the hospital because of COVID, and you may not come out. You may not come out. So like, subscribe, turn on your notifications. Angel the Psych MP. Merry Christmas. Happy holidays.